So, I know everyone is different, but this is important knowledge to have, and it worked for me. I have been getting mega heartburn for months now. Every single time I drink water, it started getting worse and worse and worse. Like, it's happened to me for years, but in the last 5 months or so, it's been bad. So I started doing a lot of research. Turns out that for me, because I did test it and I really want to document this, that water with lower pH balances is what is causing me to have heartburn. At first I was like, it can't be that simple, because I thought something was wrong with me. I have been drinking higher pH balanced waters. This one on here says it's 7.5 or higher, which is good. Probably the best you could have is in the 8s or the 9s. I have been drinking higher pH balanced waters. I ramble too much, and I don't get heartburn while drinking those waters at all. So if you notice that drinking water is giving you heartburn, just try, do your research, see which waters and what brands are the best. Drink water with a higher pH level.
Guys, welcome to Debunking Doctorlynn, and I am a second-year medical student. I personally believe that for a person to understand how medicine works, they need to know more about what is actually happening in their bodies. Physiology is how the body works, and by studying this, doctors are able to understand pathology, which is how people get sick by either viruses, bacteria, trauma, or when the body is unable to properly regulate itself. Also, by understanding this, scientists are able to create drugs that combat whatever might be going wrong. So the biggest question for tonight is, what is acid reflux? So let's start from the stomach. It is an organ that produces acid, and it was specifically designed to do so because we need this acid to digest our food. So when you swallow food, it goes through the mouth and then into the esophagus and finally the stomach. So when the stomach stretches, cells release chemicals that will activate many other signals, which will ultimately cause the release of acid. And no damage is done to the stomach unless there is previous damage to the mucosal lining, which, yes, we have mucus produced in our stomach by these awesome cells called goblet cells, and it protects the tissue of the stomach. So acid reflux or heartburn is just that, when an underlying cause is making the acid go back into the esophagus, which is very prone to damage since it does not contain any of the goblet cells that produce the mucus. In chronic cases of acid reflux, also termed GERD, cancers such as Barrett's esophagus can develop, but it may take many years to do so. And acid reflux, it's much more of a symptom than an actual disease, and it can be caused by many things, such as smoking, drinking, eating certain types of food. It can even be seen during pregnancy because there's increased abdominal pressure, and this can also be seen in overweight or obese patients. Also, narrowing of the esophagus might be caused by unknown causes as it meets the opening of the stomach. So I'm gonna apologize here for my drawings, but I was only able to put a picture as most of them come from textbooks and they're copyrighted. So here we have the stomach, and the way it is closed is by the diaphragm, and this location is called gastroesophageal junction. So hernias happen when a part of an organ goes into a cavity where it's not supposed to be. And hiatal hernias are commonly found in obese patients. I will have links to the NCBI, which is a website that publishes research papers, and it is a very reliable source. So, sliding hiatal hernias type 1 is where the gastroesophageal junction and portion of the stomach are displaced above the diaphragm. And this type of hernia is most commonly related to deterioration caused by age and intra-abdominal pressure, along with traction caused during swallowing as the esophagus shortens. So, what exactly does this mean? Well, as we age, tissues in our body, they get damaged, and over time, we are unable to repair them as efficiently as when we were younger. These repair mechanisms can also not work properly when we are deficient in some nutrients or when our immune systems are simply compromised by any type of infection or any pre-existing conditions such as diabetes. Intra-abdominal pressure can also increase when there's fluid in the abdomen or any mass of any type. And as for the traction within the esophagus, so imagine that when you swallow food, the esophagus has to stretch in width and thus it shortens. So this naturally will pull slightly at the junction. So all these conditions combined over time, they will lead to a sliding hiatal hernia type 1, because there's many types, but they're caused by different things, which are very commonly found in the elderly. And the disruption of this junction will allow for the acid to travel back into the mouth and cause the acid taste in the back of the throat. So many of you are asking by this point, why can't I use low or high pH water to cure my acid reflux? Well, first of all, because as I just explained, acid reflux is not a disease, but a symptom of a problem that could become life-threatening if left untreated. So low pH water is a weak acid. So there's no point of you adding more acid to the acid in your stomach. So that is not a choice for acid reflux. And depending on what is causing the acid reflux, a doctor will prescribe a drug specifically to that condition. In the case of a sliding hiatal hernia, it may range from proton pump inhibitors, which are drugs that inhibit the pumps that make acid in the stomach, or elective surgery. It all depends on what the patient is experiencing, and the choice of treatment will ultimately depend on the patient and what they decide to do. And of course, their doctor would have to give them more details and information, and then they will decide. So what I actually found on high pH water, which is a base, was only one scientific article by Kaufman and Johnson, and it was published in 2014. And they conducted a study which was in vitro, meaning that it was a very, very controlled experiment where they took an enzyme called pepsinogen and they tested if high pH water deactivated or not. It did, but take in mind that there's only one enzyme found in the stomach. And this experiment was done in a petri dish, which is a glass container. So the study is very limited to what it could actually translate into a human body. For water to actually be used as a treatment, it would have to be tested further and very intensively to actually be approved by the FDA. I know it sounds weird, but that's the process to approve anything. For doctors to actually be used as part of the treatment. And most likely, all this effort wouldn't go into testing water because we have drugs that work pretty well right now, and water wouldn't actually address the underlying problem that's causing the disease. So, if a doctor If the doctor gives a patient water which may or may not work at this point in time, it would actually be kind of negligence because they're not prescribing the correct drugs. So, this video is not meant to shame anyone. I personally debated with a lot of the ethical concerns on using Amberlynn or any other person as an example. So when I'm speaking about a topic, I will be using general terms to address pathology and physiology of the human body. To me, it was just not right to focus on one person while explaining a medical problem they might be experiencing, as my information is very limited to what they have released to the public. And medically, there are many possibilities onto what might or might not be going on. Again, I am not diagnosing anyone with anything. I am just presenting based on medical deduction. And the purpose of this YouTube video is to educate the public on why they should not try many of the things advised by influencers due to their potential harmful effects if they do so. Unless you have been instructed by a licensed medical professional, the audience should not disregard any information instructions previously given by their doctors based on this video. So many of the advice that is currently being provided by influencers is typically based on knowledge they gathered from non-medical websites that are not scientifically supported, or that provided from sponsors or whoever they might be advertising at the moment. And most of the time, such as this case, their own experience, which is not very good for the audience. So this could possibly and is possibly hindering how current medicine is trying to steer into a preventive practice, and that patients prefer to try out what YouTubers, influencers, and random people on the internet recommend instead of what a licensed doctor is instructing them to do. I really want the community to understand that medicine is not a cure-all science, because many of the times once damage has been done to the human body, it might be too extensive to repair and bring it back to how it previously was. I hope I was successful at bringing information to the general public, and if anyone is experiencing symptoms that resemble those of acid reflux, talk to your doctor, because if this problem is left unresolved over a long period of time, it could possibly lead to life-threatening complications like esophageal cancer. Thanks for watching. If you have any comments or questions, please leave them down below, and I will try to answer them as soon as possible. Thank you.